and then discuss those in consultation with your surgeon.
Two procedures make up over 90% of the bariatric surgeries performed in the United States: the Roux-en-Y gastric bypass and the adjustable gastric band.
This is your gastric bypass.
The Roux-en-Y gastric bypass is the most common. It's both a restrictive and malabsorptive procedure. It works by creating a small stomach pouch to decrease food intake.
This is your stomach. Show me your thumb. This is your pouch.
And bypass part of the small intestine to alter the absorption of calories.
So we're going to come across the stomach with a stapler to create this pouch. We're going to go down a certain distance into the intestine, transect the intestine, bring that distal end up and hook it up to the pouch. And then the other end will reconnect down here. We won't do anything to the stomach remnant. That stays where it is, okay?
There are advantages to gastric bypass surgery. Recent studies have shown that 83.7% of type 2 diabetes cases are resolved. Resolution of type 2 diabetes often occurs within days of the surgery. 96.9% of hyperlipidemia or high cholesterol cases are resolved. 87.1% of hypertension cases are resolved or improved. Average weight loss after gastric bypass is generally greater than after purely restrictive procedures. Most patients report 77% excess body weight loss 1 year after surgery.
The interesting thing about it is it limits what people can eat, and it gives them the satiety. It allows them to feel comfortable with that small amount of food. So that's the nice thing about the gastric bypass.
So this is the restriction part. This is the malabsorption part, okay? And this is how it works. Because of this,
as with any procedure, there are risks and complications. For the gastric bypass, the risks and complications may include poor absorption of iron and calcium, metabolic bone disease, chronic anemia. The bypassed portions of the stomach, duodenum, and parts of the small intestine cannot be seen easily using X-ray or endoscopy. And it's a non-reversible procedure.
you have to take multivitamins, you have to take iron for the rest of your life after the surgery. The other thing that you have to do is you have to increase the amount of protein in your diet.
The next most common procedure is the adjustable gastric band.
And basically what this is, it's a purely restrictive operation. There's no bypass, or there's no malabsorption that's set up. And basically what happens is we place this band around the top portion of the stomach, creating a very small stomach pouch. There's a balloon in the band, and it's attached to this port, and we inject saline or dye into this port, which blows up the balloon in the band, and what that does is it creates a restriction. So it closes things down. The band is a purely restrictive procedure, so it decreases the amount of food that you can get in at one time, so it restricts the number of calories, and that's basically how it works.
The advantages of the adjustable gastric band may include restriction of the amount of food that can be consumed at a meal. Food consumed passes through the digestive tract in the usual order, allowing it to be fully absorbed into the body. In multiple studies involving over 3,000 patients, excess weight loss ranged from 28 to 87%, with a minimum of 2-year postoperative follow-up. Band can be adjusted to increase or decrease restriction. Surgery can be reversed, although reversal surgery is not simple.
The idea is to make it tight enough so that it causes restriction, but not so tight that it causes obstruction, okay?
For the adjustable gastric band, the risks and complications may include the access port may leak or twist, which can require an operation to correct the problem, nausea and vomiting, outlet obstruction, pouch dilation, band migration or slippage. There are 2 approaches that can be taken for either of these surgeries, open and laparoscopic.
Open operations entail an incision, a big incision, sometimes bigger than others, depending on the individual. And the laparoscopic, or minimally invasive operations, are done with smaller incisions, and we use portals to gain access inside. So we're able to do really the same operation laparoscopically as we were able to do open, but with much less insult to the body.
Compared to open surgery, some benefits of laparoscopic surgery include less postoperative pain, fewer wound infections, fewer incisional hernias, faster recovery and return to pre-surgical levels of activity.
By being able to perform operative surgeries through very, very small incisions, the benefits are incredible.
Hi, Mark. Come on in. We're going to go ahead and get weighed.
There are several other procedures that make up 10% of the bariatric surgeries performed in the United States.
Go ahead and step up on the scale.
Based on your height, weight, body mass index, and other medical concerns, you and your surgeon will determine which procedure is right for you.
Some of the surgeons who perform weight loss surgery believe in one operation more than another. Once you're put asleep in the operating room, we're going to make 6 incisions. I think it's very important to choose a surgeon that has experience, and not just has experience, but is trained well. The number one thing is to really understand what's getting ready to happen to you. Number 2, I think you have to mentally prepare yourself for this life change. Excellent. Well, the next thing we're going to do is we're going to go ahead and schedule you for your preoperative lab work. Okay. We'll have you go over to the office and get that done, and also your chest x-ray and your EKG. Okay. Okay? All right.
Thank you, doctor.
My pleasure.
All right.
Coming up next, follow Teresa Leidy as she prepares for her surgery.
I had my doubts about it in the beginning, and you know, as if everything, you know, you worry, but I think I'm ready. Yeah. Do you guys want to go play over there? Go ahead.
Teresa Leidy, a working mother of 2 from San Diego, California, has been preparing for bariatric surgery for over 6 months. Her surgery is 1 week away.
Yeah, I think the hardest part is going to be the recovery afterwards.
Right.
I got really large, I like to call it, about 10 years ago. And I just kept putting on the weight, putting on the weight, and putting on the weight.
Teresa and Guy were married 10 years ago. In the next several years, her 2 sons, Nick and Ryan, were born. Since then, her weight steadily rose.
And as the boys were growing up, I mean, I couldn't even chase after them. I was always extremely tired. You know, it was just hard.
Teresa's weight rose to 250 pounds, with a BMI of 45. In addition, she began suffering from a variety of comorbid conditions. She tried diet after diet, only to gain the weight back. And more. Shopping for new clothes as her weight rose became a real chore for Teresa.
I'm up to size 24, and my pants are tight now as a 24, and I'm just like, you know what, this is not happening. I don't want to go up any bigger. You know how hard it is to shop for that size and spending $50 on a pair of pants, and I was weighing myself every day, and I would lose a pound, I'd gain 2 pounds. I think that was the hardest thing, is knowing that I failed, and I don't want to fail anymore. That's my big thing.
After deciding to have bariatric surgery, Teresa began months of preparation and discussed options with her physician, Dr. Whitgrove.
Yeah, there's a lot of discussion about what really is the pre-surgical importance. Did people just kind of go along their daily life and then all of a sudden here comes surgery, or should they have some kind of preparatory pattern?
I think you have to mentally prepare yourself for this life change, and I think you should do it prior to the surgery.